Hi, I'm Dr. Faber, and we're going to discuss insomnia, which can occur in children, adolescents, and adults. One cause of insomnia may be related to anxiety or stress or even feelings of depression. And insomnia may manifest as trouble initiating or maintaining sleep. And so I mentioned initially these first potential causes because we want to rule them out when then targeting and addressing insomnia alone. So if a person, for example, is very anxious and worried and it prevents them from falling asleep, they might consider some worry time, maybe 10 minutes, 15 minutes early evening, identifying the worries and maybe challenging those thoughts or worries. If it's more a function of mood, we know with depression there may be early morning awakening, and it's important that we can reassure the person that as the mood improves, usually sleep also seems to regulate and improve. And so those are some mental health related factors linked to insomnia. Insomnia otherwise is very much a behaviorally based condition, and it may even be referred to as conditioned insomnia. Each individual seems to have their own unique pattern in terms of their sleep schedule and when they have sleep-related difficulties, their pattern of sleep wake-ups or insomnia intervals occurring. So one strategy to address insomnia is called sleep hygiene. Sleep hygiene includes things such as turn the clock away so you don't see it while you're in bed, because you'll watch the clock, then worry, why aren't I asleep yet? Then you'll continue to watch the clock. A second strategy with sleep hygiene is use the bedroom primarily for sleep. If you fall asleep in other parts of your home, then it's hard to identify just your bed, your bedroom with sleep. Next, we say very important to avoid caffeine, especially after 12 noon, because the metabolites of caffeine may stay in the system for quite a while. Another strategy is to take a hot bath or shower just before falling asleep, because body temperature goes up in the hot shower or bath, then you step out, your body temperature precipitously goes down. Lowering body temperature can be associated with deeper sleep. And so this too can be effective. It's very important if a person, particularly in adults, if they have trouble staying asleep and they wake up during the night, they should not remain in bed, for hours wondering when am I going to fall asleep again, but rather leave the bedroom and go to another room in order to maybe read a book, relax, and only when sleepy, return back to bed, whatever time that may be. And then wake up the next day at the same time every day. So even if a person doesn't get enough sleep and they wake up the same time every day, they will eventually feel very, very tired over a period of days or a week or so when it is time to fall asleep. And it will lead, hopefully, to staying asleep through the night. This is sleep restriction, restricting your time in bed to time asleep. And this complements sleep hygiene. Also avoiding naps, because if a person takes naps in the late afternoon, then they may not feel as sleepy as they ought to when it is bedtime. They may stay awake, not get enough sleep, and then again want to take naps the next day. It's important to break that cycle. And then finally, there are some other specific relaxation type strategies and cognitive behavioral strategies that can be used to address insomnia. So we spoke about earlier, if a person finds themselves worried or preoccupied about the next day's events, they can identify those thoughts as worries and challenge them. A person can also practice just breathing exercises to calm and relax themselves, breathing in through your nose, holding it, blowing out through your mouth. A person might even try progressive relaxation, relaxing muscles from head to toe while doing breathing exercises. So sleep hygiene, sleep restriction, and relaxation exercises are all potentially very helpful in addressing insomnia. Thank you.